Good afternoon. Welcome to the most active part of this symposium, which is exercises to treat Parkinson's disease. Let me see how that works. Okay. So let me start with this. Every time that I see a patient with Parkinson's disease in the clinic doing well, they have something in common. All of them, they are doing some type of exercises. All of them, something is doing. And I'm not talking about the exercises that you do when you walk from the bathroom to the kitchen, to the kitchen to the bathroom. No, I'm talking about real exercises. By the way, this topic applies to everyone. It's not just people with Parkinson's disease. So no disclosures. This is the questions. Let's take 1 minute to try to answer this question, and then we will go over this question later on. I will read for you. A patient was diagnosed with Parkinson's disease a year ago after starting having motor symptoms. The doctor prescribed carbidopa, levodopa, Sinemet, and give some material education about motor and non-motor symptoms of Parkinson's disease. What other important referral and or material education or treatment should be given or recommended? And the other question is, what we can do to be consistent and motivated with exercises? Okay. I do not think any healthcare provider will disagree with this statement. Okay? Exercise is good for your health. By the way, I do not pretend you to do this or to do that or to look like Andreas Koholin. Okay, actually, this guy is real. He's 69 years old, professional bodybuilder. Okay, you can see him in many websites, and he's a famous guy. Okay, so this slide basically summarizes the main point of this presentation. Is exercises like medicine? And the short answer for this is yes, in many ways. In many ways. Only work when you do it. It's like medicine. Only work when you take it. If you don't take the medication, it's not going to work. Stay persistent is the key here. You need to stay persistent, otherwise it's not going to work. Make it a lifestyle habit. Habit is very important. Set realistic goals and don't be afraid to change them if needed. The big problem is that approximately 80% of the U.S. adults are insufficiently active, which means that, in other words, 20% of the people are doing sufficient exercises, enough exercises. So what does that mean? So for this, based on this paper, doing enough exercises means that you are doing at least 2.5 hours of aerobic exercises, at least moderate intensity, and 2 days per week of resistance exercises. Okay? So the good thing is at least we are improving. Right? You see the curve going up, but still only 20%. And that sounds a lot, but this is what it is. Now, I like to divide this topic in three questions, 3 areas. This is how we are going to discuss: the why, the what, and the how. Okay? Why we need to do exercises, then what type of exercises, and how we stay consistent with exercises. The why is the easy part. So every healthcare provider will tell you to do exercises because it's good for your health. They are not going to do it, but they recommend it, okay? And we have plenty of data to support that, you will see. The what and the how is the difficult part, okay? Why is important? Let's start with the first one. Why is important to have a regular exercises program in PD, in Parkinson's disease? Well, this young lady here, she's actually 104 years old, and she is the faster runner over 100 years. She actually has the record in 100 meter dash of 40.12 seconds. So she's really fast, okay? And she's, that happened in 4 years ago, okay? She just, at that time, it was 2017, and so 4 years ago. And right now she's 105, 104. So let's talk about the general benefits in Parkinson's disease, actually in elderly, but extrapolated to Parkinson's disease, okay? Number one, it will help you with your cardiovascular health. When I say cardiovascular health, I mean that decrease the chances of you having a stroke, heart attack, peripheral vascular disease, improve diabetes, okay? And also decrease the probability of you dying from those diseases. Also, bone health, very important, improve bone health, but remember that you have to do some weight-bearing exercises to increase the density of your bones. Decrease the risk of you having some cancers, specifically, and because we have more data, with colon cancer and breast cancer. How that happened, we are not completely sure about that, but that's the epidemiological studies. Prevent and treat obesity. And the most intriguing part is this study published 5 years ago in a very important journal named Circulation, showing that sedentary lifestyle, which we call sitting disease, is worse, might be even worse than having diabetes, hypertension, and smoking. Sitting disease, this is how we call it now. Now let's be more specific. Now let's talk about symptomatic effect in patients with Parkinson, based on the literature. So let's start with the cognition. When I say cognition, I mean the thinking, okay? So memory is one of the domains. There are many domains, but let's talk about the thinking process. So we have data showing that physical exercise program improve cognition in patients with Parkinson, okay? With mild to moderate stage. Which type? So we have the Argentina dance, a very famous type of dance, a tango. The cognitive training combined with motor training, which is doing some type of physical activity combined with some calculation, some mental activity, combination. And also we have a treadmill training. And actually, for example, if you do 3 times per week of 1 hour of treadmill exercises for a period of 6 months, that will improve your cognition and your quality of life. This study published recently, last year, showed that treadmill walking, stationary bicycle improve physical fitness. LSVT-BEAG, which is actually very famous, type of treatment that we typically prescribe in our clinic, improve motor symptoms in patients with Parkinson. So, and this is based on a scale that we use in the clinic. When you guys see me in the clinic writing numbers in a paper, I'm calculating your UPDRS motor scale. That helped me to follow up you through all these years. So LSVT showed that decreased those numbers, so improve motor symptoms. When I say motor symptoms, I mean the stiffness, rigidity, and slow movement. Tremors, no. And actually, it might allow you to take a lower dose of levodopa. There is a few studies, I select this one, that doing at least high intensity exercises, combining aerobic exercises with stretching and resistance exercises, improve sleep in people with Parkinson's disease. If you have a lot of depression and anxiety, which is very common in the setting of Parkinson's disease, this is what I would recommend: yoga and aerobic exercises. I am not a fan of yoga, but it's good, so we'll talk about that later. Tai Chi, I like Tai Chi, okay? And we'll talk about Tai Chi soon. But Tai Chi is an exercises that improve mobility and balance. So if you have a lot of balance issues, that's the way to go, okay? Tai Chi. And there are many options that we'll talk soon about that. Disease modification, this is a big question. The short answer for this, I don't know. We are not sure, okay? We are not sure. Based on epidemiological study, people who are physically more active might be lower risk to develop Parkinson's disease. But we don't know how that happened. And how those patients that I see 4 days a week doing well, all of them are doing good exercise routine, usually a combination of exercises. So something is doing. The thing is, we don't know. We are not sure. So there are many studies going on right now to answer that question. So the main thing here is that by far, exercises outweigh the risk. The benefit outweigh the risk when you do exercises. Again, the most important thing is improve your physical fitness, improve your score, the numbers I get in the clinic when you come to my clinic. But always there are some risks. Everything in life, there is a minor risk, right? So our concern when you start doing exercises is, number one, that you can have a heart attack, okay? Or you can have a fall, okay? Yeah, this is a concern. But again, you can have a total knee replacement because you need that, because you want to improve your function, and there is a risk too, right? However, the risk here is very low and almost the same as the patient that they don't have Parkinson's disease. So the control group. And just to answer that question more clear, how safe is exercises in Parkinson's disease? Very safe, okay? There is no evidence showing that doing exercises make your symptoms worse, okay? And I know that this is a concern on some patients. Oh, doctor, I don't know, I'm scared about making my symptoms worse. No evidence for that, no evidence, okay? And actually, the adverse effect is the same as the control group, okay? So it's the same. You just have to be careful. However, obviously, if you have chest pain or shortness of breath when you walk from here to the door, that's not good. So in that case, you might need to have a medical clearance, especially from a cardiologist, because you really can have a heart attack. So before, if you have symptoms suggesting cardiovascular diseases, especially in the setting of diabetes or renal failure, because the symptoms of having a heart attack in patients with diabetes are not the same as the regular population. They don't feel the chest pain, they just feel shortness of breath, okay? So you have to be careful with that. But if you are concerned about that, get a clearance from your cardiologist, okay? You talk with your primary care doctor and talk about your symptoms before going to a high intensity exercises, especially if you are not doing exercises never in your life and you want to start now, okay? That's very important. Now let's talk about the what. What type of exercises? Let's talk about the important question here, the what and how, right? So the key here is make sure that your type of exercises match with your physical capabilities, right? For example, if you have a lot of arthritis, if you have a lot of knee pain, maybe jogging, walking, brisk walking is not good for you. maybe you need to do some other activities with low impact, such as biking or better, swimming, okay? Swimming is very good for those patients that they have a lot of pain. And so if you don't have a pool, then there are some places that they actually give classes of aquatic therapy here. We'll talk about that soon. I like this 3 wheels bike. Looks scary, but actually it's very fun. I tried once, and it's pretty safe. The only thing, be careful when you take a curve, okay? I have seen guys, actually here in Knoxville, there is a trail. I forgot the name of the trail. But I saw that guy, he's a senior guy, going so fast. I was, wow, like, you know, you have to be careful, especially when you take a curve, okay? But especially when you have a back pain, having a recumbent bike with a lumbar support will help you, okay? Will help you to not exacerbate your pain. And it's a very good exercise, okay? If you ask me about, okay, but this is very pricey, yes, it might. Actually, if you check this in Amazon, the price of this bike, 3 wheels, is $600, okay? $600. But you can find this one, the recumbent bike, under $500. So you can, it depends on the quality of the bike, okay? But you don't need to have a fancy bike. You just need something that works for you and have a good support your back, and that's it, okay? Now, I like this book. I bought this book. The cost is less than $7 on Amazon. It has a lot of illustration to teach you what to do when you are in the pool. But I always recommend, if you are going to start this, to do it with a professional, okay? So, there is a gym here that we call the National Fitness Center in Knoxville. They have actually classes. I checked the website, and they have classes for people with MS and Parkinson's disease. Okay, I don't know the cost. I don't know how much, but would be a good idea. And especially because our population, they have a lot of arthritis, a lot of pain, and aquatic therapy is very nice and very fun. It's just good. I really like it. And this is what I would do if I have a lot of arthritis in the future. I don't know, we'll see. These machines, ellipticals. So they are good. You are working your whole body, actually. It's like the mix of doing skiing and climbing stair. The problem is getting off and on of this machine. If you are having issues walking and with balance, be careful, because you will end up on the floor, okay? So if you have somebody who can supervise you and help you to get on, okay, and get off, good for you. So that's pretty good. I really don't like it too much because it's like kind of boring for me, but it's an option, okay? And again, the prices vary, so it could be $400, $300, or could be even $1,000. There are thousands. The price could be high too. Now, LSBT. This is what we actually prescribe. I'm sure that my colleagues also prescribe that a lot because it's effective. We have data. People like it. It's fun. And so actually improve the speed of your walking, okay? Improve. Even more than doing what we call Nordic pole walking, which is walking with 2 sticks, okay? Even more than that. It's basically doing high amplitude movement or exercises. The thing here is make sure that the therapist is certified in LSBT. So how do you know that, and how do you find a center who has therapists certified on this? Go to the website here, LSBT global website, and you can find out, okay? I believe that we have many therapists certified on this in Knoxville. Boxing. I really like this. And I will tell you later that if I'm going to have Parkinson's disease in the future, I will be doing boxing. I like it. Okay, I understand that every time that my prescription always say, I want you to try LSBT or boxing. But when I say boxing, guys, okay, ladies, open the eyes like this. Okay, so they don't want that. But when they go, they like it. Okay, so you just try, and actually you can try for a week. If you don't like it, don't go anymore. But try, okay? And remember, some people think that they are going to put you to fight with somebody else. It's not like that, okay? There are people asking me, but you're going to fight with some? No, it's not like that. Okay, and it's very effective. We have some weak data, but the data is there. Improve the quality of life and mobility. You can find a class if you go to this website, okay, rockysteadyboxing.org. Dancing with Parkinson. So, good. We have some data. I don't think you will see me doing this if I have Parkinson. Number one, because I don't like it. Number two, because my wife say that I have 2 left feet, so I don't think I will be doing this. But it's fun too. You have a lot of people. It's music. Might improve your motivation. So it's an option that you have. But remember, this is based on preference. Okay, I cannot tell you which exercise would be better than the other. But this is a good thing to do and to try as well if you like it. But again, it's not my preference. Tai Chi. Tai Chi, we have data that improve balance and decrease the chances of you having a fall. Okay? So if your main issue is balance, Tai Chi is the way to go. Okay? And how you can get Tai Chi, number one, very easy. You can YouTube. There are many YouTube videos, okay, lasting 1 hour, 30 minutes. Good YouTube videos. There are DVDs. And I don't know in Knoxville if there are any place in Knoxville that we have this. I'm not sure, but it's very easy to get a DVD with Tai Chi for Parkinson's disease, okay? Because there are different levels, okay? So you have to be careful which one. So Tai Chi, for the people, so many people don't know what is that. Come from China. I want to say is the mix of martial art with some meditation, okay? It's like mixing yoga with some, I don't want to say taekwondo, but something like that, okay? And it's continuous movement, so improve your balance, okay? Very good. And it's like a therapy for your mind too. So this is basically the summary of what we are talking here, and you can find this very easy on the Parkinson Foundation website. Actually, we have a copy of this on our clinic. You can Google this, and you can find this paper very, very easy on the internet. Okay. Now let's talk about my exercise prescription. Okay, this is me. This is what I will prescribe to my father if my father starts developing symptoms of Parkinson's disease. Why? Because I know him, I know his preference, I know his limitations, and I know his diseases. So this is my prescription for him. I sometimes use my father in videos because I'm monitoring him, because I think he might have some symptoms, but I'm not convinced yet. Anyway. Weight training, okay? This is what I'm going to recommend first, weight training. So weight training is the base of any sport, is the base. You are not going to see any high-performance athlete getting to the high levels without doing weight training, okay? The same applies with Parkinson. So weight training is key here. You need to do this. I prefer if you ask me about, okay, do you prefer a weight machine, free weight? It doesn't matter. I really prefer resistance bands because you have a Constant contraction in all range of motion, different from the free weight, that the free weight stop here and stop here. So in the band, these bands that you see there, so you have a constant contraction of the muscle with the bands. And actually it's more, the movement is more stable, so technically the chances of you having a lesions, injury are less. I really don't know if we have data for that, but I think that will be safer with a TheraBand. And especially if you are having a free weight, can you imagine what happens if you drop the free weight? Right? So it's safe. So in terms of frequency, 2 days will be fine. Try to do it at least 48 hours apart, so to let the muscle to recover, okay? That's the key. Then aerobic exercises, of course, okay? There are many options. We talk about options, but in terms of my father will do most likely regular biking, okay? Why? Because he doesn't have back issues. He doesn't have a significant arthritis at all. So I think he will do regular bike, okay? Now, all these things that I'm talking depends of where you live. For example, if you live close to a high school and they have a track, good for you, okay? And if you can use a track. Fortunately, actually, you can use the track in the high school here in Knoxville if the students are not using the track. So this is a good thing of living here. And actually, a track would be nice for somebody who is having a lot of freezing of the gait, okay? When you freeze, when you turn, when you stop, and you are in that track, usually you don't freeze because you are in the open space, okay? So it would be nice for somebody with freezing of the gait going to the track, especially because the track is flat and you don't have obstacles, okay? You don't have things like in the street on the sidewalk. That's the main issue, right? Having a fall. So you have to be careful with that. The other thing I forgot to mention to you, going back to the resistance exercises, is the routine I prefer to be designed, the routine should be designed by a physical therapist, okay? Why is that? The physical therapists are actually very well trained in evaluate you from the functional standpoint. They evaluate you also based on your abilities and the disequilibrium that you have in terms of muscles, okay? So I would totally recommend, if you are going to start, if you have Parkinson and you are going to start a real routine of weight training, to see a physical therapist. There are also personal training, certified personal training, that they are very well trained, and they will do an excellent job too, and so that's fine too, okay? It's just to look for the correct people. What else? So the goal here is just to do a 30-minute section, okay? 30-minute section, progressively increase to 2.5 hours per week. So which means that 30 minutes, 30 minutes, 30 minutes, 30 minutes, and 30 minutes, okay? Or 5 days. That's the idea. That's what I would do. And then I would tell my dad to do a combination of exercises, mind exercises, and sometimes that work with balance. So I told you I like Tai Chi, so I would be doing Tai Chi. And the frequency 2 times a week will be fine, so you combine these. So the idea here is to have a combination of exercises, not just one, okay? It's a combination of things. And actually, I will alternate the Tai Chi with boxing, okay? So you can do that. You can do 1 month, 2 months of Tai Chi, and the next month with the boxing. So that's a choice, right? Now, let's talk about the last part here. How we can stay consistent. That's the most important thing, right? And this is why we fail. The key here is to visualize yourself as an athlete, okay? Establish realistic goals, short and long term. For example, one day you take your time, how long take you to walk 2 miles. Write it down and try to improve that time. So put goals in your head because that would push you, okay? Like I say, goals should be measurable. So it's good to have numbers, okay? It's not just doing things without numbers. I like to see numbers. Make a habit, like everything in life. Start small and increase progressively. Be patient. Be patient is very important. You are not going to see benefits just in 1 or 2 days. It's going to take months. Have somebody with a better mindset to join you. This could be your partner, mom, dad, or could be even a dog. Could be. Be careful with the dog. Don't fall. This is the one thing. So every time that I have a patient in the clinic falling down, I ask, what happened? Oh, my dog, at least 50% of the time, okay? Dogs are good. I have 2 now, 1 died. But that might actually precipitate a fall, okay? So you have to be careful. So this is the daughter or the wife always asking me this. Doctor, what can I do if he doesn't want to do exercises? So I divide this in 2 stages, 2 parts, right? Number 1, make sure that you are not missing things that decrease the motivation, okay? For example, is the patient eating well? So nutrition is very important in Parkinson. This is some topic that we need to discuss in the future. But make sure that the patient doesn't have depression, sleep problems, we discussed about sleep, hypothyroidism, medication side effect, and chronic pain. These are very common conditions that if you don't treat this, the patient is not going to be motivated. The patient is not going to do exercises. So you need to work on that first. Other thing is try to be on before doing exercises. So if you need to do exercise at 8 a.m., take your levodopa. When I say levodopa, I mean this, I call it the gas. That's levodopa. I'm talking about Cinemet, Ritari, all these medications. Take at least 40 minutes. So if you start at 8, the exercises, 10:15, take your pill. Okay? Something like that. It doesn't need to be so perfect like that, but close. Okay? You need to be on. You need to know yourself, and you need to be on before doing exercises, right? Now, the stage 2, after you rule out all these conditions and address all these things, then you do this. One thing is to sign up. Sign up in some type of classes, okay? Why? When you pay something, you have the pressure to do it, okay? I don't know if that happened to you, that happened to me. For example, if I going to buy something in that restaurant and I don't like it, I eat it anyway because I pay for that. So it is a way to indirectly to push you to do things. Go with him, go with her. They need support, okay? This is very important. Peer pressure. Have a schedule, have a structure, okay? If you don't put time, this is not gonna work, okay? It's not say, I'm going to do exercises. Okay, tell me the time. At what time? At 9 a.m.? Tomorrow? Yes. So you have to write it down. You need to have a schedule. Have the schedule prepared at least a week in advance, okay? Go slow. Let your body and mind to adapt. And even if you start 5 minutes would be enough to start, okay? Obviously the key is to keep increasing, right? But for your mind, it's okay to start with 5 minutes. It's okay, okay? It's just try to progress, and progress until you reach your goal, okay? It's a good start, 5 minutes. What about if I hate exercises? I hate exercises. There are many people who hate exercises, okay? So, well, you are not alone. Me too. I don't like to do exercises, but I have to do it. Why? Because I think about the benefits, right? And the sensation that you feel when you finish a race, when you finish your workout, it's just, it's just, I cannot describe that. It's painful sometimes, yes, it's painful. But we have to do it. It's like you need to have a habit, and it's like eating too. Especially if you have Parkinson's disease. So I always recommend to, okay, you hate this. Write down at least 1 or 2 things. Why? Many people are because they are scared of falling down, okay? Many people are because they think that doing exercises will make your symptoms worse, which is not true. I prove you that. I have data, right? So talk to your doctor about those concerns, your Parkinson doctor, and try to work on those problems and reasons why you hate so much doing exercises. Think about the benefits. That's the main idea here. There are so much benefits. Just think about it. Thinking about the future, right? For example, if you want to live longer and you want to be functional, that's the way to go. If you don't want to be functional and you don't want to live longer, then exercise is not for you. So try to find an activity that fits with your personality and abilities. Okay? So very important that you try to, like I said, boxing, dancing. I prefer boxing. You see? So now, try to find a good workout body. I think this is a good technique. And you know, there you can find your partner. I have my running partner. This is Nacho. This is my running partner. He's actually a 120-pound German Shepherd, 3 years old. He's my running partner. He doesn't like to run in the treadmill at all. He doesn't like to walk in the treadmill. He actually uses the treadmill to rest, okay? However, in the street, he's really good, okay? So in the street, he can run less than 8 minutes per mile, but after 3 miles, he slowed down. So this is my body boy. So to summarize this, there is no reason to believe exercises does not help to improve quality of life in people with Parkinson's disease. Exercises is medicine. The key here is being consistent, okay? It's not doing exercises for 1 month, 2 months, and then stop. I hear people in the clinic say, oh yeah, I did the LSBT 2 months ago, and I graduate. What does that mean? So basically, they did it, and that's it. That doesn't work like that, okay? You need to keep doing exercises. So if you do 2 months of exercises and 4 months without, and you are waiting your doctor to refer you again because you were 4 months off on vacation exercises, this is not going to work, okay? You need to have habits, otherwise it's not going to work. Look for professional help. Like I say, a physical therapist, they are very well trained to design a good exercise program, personalized, based on your deficiencies and disequilibrium. There are a lot of muscle disequilibrium. They can understand which type of exercise would be good for you, okay? So I always recommend, if you can, to get an evaluation by a physical therapist, especially when you are going to do resistant exercises. And the last thing is, if you don't want to do it for yourself, sometimes we don't want to do things for ourselves. Just do it for the people who really love you, your kids, your grandkids, even your dogs, like Nacho.